So much for the second debate session. We now proceed to the third debate session. The themes are poverty alleviation, welfare, medical services, public health, and elderly care. This session covers the following 6 policy areas: poverty, welfare services, including social enterprises and family matters, support for ethnic minorities, health services, food safety and environmental hygiene, and elderly care. Members who wish to speak in this session will please press the Request to Speak button. Mr. Leung Yiu-chung. Mr. President, C.Y. Leung, the Chief Executive, has his popularity rate going down all along, and the CPG is also concerned. In order to rescue himself, he tried to make use of the policy address to save himself. Unfortunately, after the release of the public address, not only his reputation cannot be rescued, the reputation of the SARG is also in trouble. He tried to pose an image that is trying to create an intimate relationship with the local communities and members of the public. And he tried to resort to all sorts of tactics to attack his rivals. He tried to paint a rosy picture of our society. By doing all these, he would like to change his popularity rate. Unfortunately, what did he get? He got the opposite. That's why he is greatly disappointed and shocked. Undoubtedly, the CE and the SARG can make use of the policy address to rescue their popularity rate and reputation. But that shouldn't be the main objective of the policy address, but just an effect. The purpose of the policy address is to allow the public to know the orientation, direction, and priorities of the administration in planning for a future blueprint. For C.Y. Leung's policy address this time, in relation to these aspects, only very few coverage were given to them. Sometimes he not even mentioned the aspects. And when he mentioned them, those are only fragmented initiatives and measures. The policy address is not up to standard. It has not addressed public aspirations. Therefore, this policy address is absolutely a failing policy address. He failed to canvass public support. Therefore, he shouldn't receive a vote of thanks from this council. So I'll oppose the original motion. As for the amendments, I'll support most of them, save for one of them. Mr. President, in his second policy address, the CE emphasizes poverty alleviation, which is his first and foremost task. However, he has disappointed us. Next year, there will be a low-income working family subsidy. Eligibility criteria are mapped out in the policy address. In fact, all along, the public has been asking for this. This is a policy to address public aspirations. Originally, this measure should have received a lot of applause. However, the devil is always in the details. Now, this policy is neither here nor there. In other words, the whole policy is just better than nothing. Concerning this subsidy, according to the policy address, the recipients must satisfy all sorts of requirements in terms of working hours and wages. The conditions are harsh. If this policy is to be implemented as it now stands, not many people will benefit. It will not effectively assist the needy families, and poverty alleviation will not be effective. It will not be able to address the wealth gap issue in Hong Kong either. According to the policy address and what Mrs. Carrie Lam said, the applying families must satisfy 4 criteria. A family has to work 280 hours unless the subsidy will be reduced or withheld. Mr. Matthew Chung repeatedly emphasized that this is to encourage the concept of work more, earn more. Now, this concept sounds grand, but what's the original intention of this measure? It is to assist the low-income working families. Why is it that working hours should be one of the criteria? Why shouldn't we just use the level of wages? If you look at the duration of working hours, you'll be disregarding the rather serious phenomenon of fragmented working hours, and you are placing the responsibility on one person. You have excluded the uncertainties about job types and working hours. And then about income, the calculation method is inconsistent. If 2 or more family members are working, you will only calculate the working hours of one person. That is, the working hours are person-based. But for income, you take the whole family in your calculation. In this way, it is against the principle of fairness. This indicates that the C.Y. Leung's government, in order to hand in its homework, randomly and casually suggests this policy without looking at the needs of these families. This is not a subsidy to award those who are working hard. Now, this subsidy is to ease working poverty. Therefore, you have to emphasize needs. For example, for the recipients, the lower their income, the higher the subsidy level should be. But now working hours is the focus of this policy, and you emphasize the concept of work more, earn more. This is against the legislative intent for a standard working hours. Does it mean that you have no intention to implement standard working hours? You're dragging this on, and you now use working hours to calculate this low-income working family subsidy. Is it that you have no intention to legislate for standard working hours? Long working hours affect health, and as a result, family harmony is affected. For example, workers working in other districts, they have to cross districts to work. They don't actually have personal time. Without personal time, they cannot do parenting, further their studies, upgrade their skills, and so forth. We see nothing about all these in this policy address. Grassroots workers would like to have low-income subsidies. They work very little working hours. They also earn very little. But if you ask for 280 hours, then they will be entitled to this subsidy. If we use the standard, they have to work on the average 8 hours per day. But if they work 8 hours a day and still earning a low income, that means wages are low. We know that in the past 3 years, although we have a protection under the statutory minimum wage regime, which has increased from $28 to $30, that is to be reviewed. Rentals are high. Food prices are also high. All these impact seriously on the living expenditure of low-income households. If the SMW is to be reviewed once every 2 years only, it won't be able to catch up with inflation. Therefore, we request the government to change the 2-year review cycle to a 1-year cycle, such that the living quality of the public will not lag behind inflation, such that the living quality can be safeguarded. At the moment, extra allowance is proposed for children, neglecting children with special education needs, the SEN students. Extra subsidy should be given to families with SEN children. which may have to spend more on education and health care. This is to resolve their learning difficulties. And behind this policy, the government has disregarded the needs of families with elders. At the moment, for the OALA, that is OA Living Allowance, the allowance has to be included in the family income. By doing so, in future, such families may not be entitled to the low-income working family subsidy. That's unfair. Therefore, we ask the administration to reconsider the possibility of excluding wages from the regime. Otherwise, the policy will be conflicting with the OALA policy, and society may become divisive. Besides, the disharmony between two generations may deteriorate. So we would like the administration to amend this policy. As for childcare services, we've been mentioning for many years, as women organizations said, we would like to have more childcare services so that more women can work. Unfortunately, the government has been offering very little subsidy for nursery services and childcare services. Although a neighborhood childcare scheme has been put in place to encourage volunteers to help out, the government has not been dedicated to the provision of childcare services and to assist women to work. The government's definition of productivity is very narrow. Only paid labor is considered as productivity. Women take care of households, they do household chores, participate in family activities, etc., etc. All these have been neglected. So, the government considers women to be non-productive. Just look at a 2010 report. Data indicated that there are 74,000 full-time carers. 78%, almost all of them, were women. Has the government ever considered how it can assist these women to join the workforce? Should we not consider family care as something productive that is to be included in the term productivity? All along, the government harbors the concept that males should go out to work and women should stay in the family to take care of the family. As a result, in society, many women are in poverty. Why? In 2011, for CSSA recipients for 10 years, all along, the women outnumbered the men. As a result, women were unable to be productive, so to speak. They're not included in the term productivity. So we're not making full use of social resources and help with overall social advancement. Therefore, we should consider how we should make women retain their dignity and to help them release their productivity and contribute to society. In the past, in such an environment, many women dare not raise children. As a result, we have a demographic problem. That's why the government is looking at its demographic policy. That is actually what the government has to bear its own consequences. There are only 720 nannies providing after-school care to children. Well, there are 5,400 such nannies, and under the CCF, we have 4,400 quotas. All these add up to 10,000 only. For children between 0 to 12 years old, almost 600,000 of them.
And there are about 700,000 home carers. As I said, most of them are women. So you see a big difference and gap in the situation. We therefore hope the administration can do something to improve the situation. For example, to put in family-friendly employment arrangements, etc. We have been talking about these for so long, but the administration has not done anything. We have asked the administration to review the employment ordinance for continuous contract to attach to 4 weeks and each week 18 hours. And also you should formulate standard working hours, but you have done nothing. All these have a bearing on the development of families and women, but you have not done your job. So we are asking the administration to put in place equality between the genders, so women have the right to make a choice to join the labor market or to care for the home. This will be beneficial to the quality of the family and also to society, and there can be sustainable development. We hope you can do more. We also propose that in terms of women development, there should be a 3-pillar proposal. The first pillar is nursery service in the community, 2 subsidy for carers, and 3 family-friendly policies. Overseas experience tells us that when you have nursery services and also provide subsidy for carers, then you are going to make up for the financial pressure that they suffer because they do not work in society. All these must be in place at the same time. All the 3 pillars are as important. And there must be policies to help family harmony. We hope there should be paternity leave and also standard working hours. We should also have leave for carers, and at work you must provide childcare services. We believe this will release the labor of women, and also it can help enhance the quality of families. President, I still have some time. I'd like to go back to housing. Maybe you will say, why don't you speak in the second session? This is mainly because housing stems from poverty, so it's related to this session. Why do I say that? This is because, as you know, when we talk about housing, we always talk about the housing needs of the grassroots. We seldom hear that there are problems with people who work. We believe they have money because they work. But then there are grassroots workers who always have a housing problem because they don't have money. They would like to live in inexpensive housing, but we do not have enough inexpensive rented accommodation. They live in very poor conditions. As a result, they live in subdivided units, and sometimes they have nowhere to go, and they are reduced to street sleeping. All this boils down to the fact that they have a very low income. They cannot afford to pay the rent. I hope, therefore, that Mr. Matthew Chung, you will talk to the CE, put pressure on him, and tell him that if he doesn't solve the housing problem, there will be more expenditure for the community. Why do I say that? There is a no rent subsidy scheme. Those, of course, who are on CSSA are assisted with rent payment, but then it is not solving 100% of the problem. Why? Because the landlords know how much rent subsidy is paid to the tenants, and they raise rent accordingly. In the end, those who benefit are not those who are on CSSA, but the owners of properties. And this means more expenditure for the administration. To resolve the problem, you must build more housing. And moreover, the CE replied to me this question at the council, and that is rent control. The bureau chief said that there are views for and against rent control. the other time, the CE replied me directly to say that there shouldn't be rent control because there will be more impact on the market. I hope I will say this so Mr. Matthew Cheung will say this to the CE. And that is, I hope some studies will be done before he draws a conclusion. Please do not arrive at a conclusion lightly. We had rent control in Hong Kong and it did not result in what he said. Why don't you conduct a study first to gauge the situation? Without rent control, grassroots are in dire straits. What is happening to them, Mr. President? They rent subdivided units, and the tenancy is not for a year or 2 years, not even half a year. It can be as short as 1 month. Why? Because the property owners want to increase rent incessantly. Even if they don't do that, they will issue the threat of rent rise. And tenants are under huge pressure as a result. Therefore, I hope that on the issue of poverty, Bureau Secretary, please talk to the CE, ask him to do a study on rent control and discuss with the community instead of saying no right away. Mr. President, now I'd like to talk about constitutional development. Again, you will say this relates not to this session but to the next. But I'd like to address it. Why? This is because constitutional development has something to do with poverty. We do not have an elected government. The policies it formulates are not in line with the public's aspirations. Very often, well, I can give you an example, Mr. President. We used to have the urban council and the regional council. Those were elected councils and they were given the power to formulate policies. Many policies were made which responded to the public's aspirations, including hawker and market policies. At that time, markets were operated in such a better way than what they are like now. Now the markets are almost deserted. Why? Because urban councillors and regional councillors listen to the public. They would conduct site visits to see what is happening in the districts. If the government were elected by the people, there will be accountability, there would be representativeness, and the policies it makes will not be like the policies we have now, that they go against public views or they make policies that in a way seem to respond to public opinion. So I hope we will eventually have democratic elections so that we will resolve this wealth gap that has plagued us since the handover. Without a democratic system, without a government with the people's mandate, we can hardly achieve that. And we are now talking about selecting the chief executive. There will be one man, one vote, but if there will be screening or if there will not be public or civic nomination, then we'll have the same situation as we are now. It will not be too different anyway, because there will be no public nomination. Even if there will be one man, one vote, we still cannot allow the government to have legitimacy. So it will not be accountable to the public. And later on, the PAs will just be like the PA we have now. It is something that is only responding to the public in form and not in essence. So, Mr. Cheung, if you really want to resolve the problem of poverty, I hope you can support a democratic government, or else no matter how hard you work, you cannot resolve this problem of poverty, and you cannot resolve the most important problem, which is the wealth gap. Mr. President, in a way, I have ventured outside the scope of this session, but I hope you understand that all these issues are interlinked. They are not independent issues. Thank you, Mr. President. Dr. Joseph Lee. President, I will concentrate on elderly services and public health. First of all, public health or hygiene. Undoubtedly, the PA has talked more about hospitals, which are health issues, and also that people would be subsidized in having colonoscopy examination. But it has some additions or deletions, but then there are not too many new ideas. Now, I'm talking about the more important issue of positioning. How do we position Hong Kong's public health delivery service? The bureau chief has talked about a dual-track system, but there is no mention of it this time around. What is the dual-track system? You have talked much about the public system, but not the private system. If we still talk about a dual-track system, the public will be asking you, how should we select public or private services? And also, apart from rehashing old issues and two additions, in terms of treatment, you are raising people's expectations, so people expect you to increase resources to tertiary treatment. There will be higher expectations and you are creating demand. Mr. Bureau Secretary, this is the wrong kind of aspiration management. You have to manage demand, you have to manage people's aspirations, but then you are creating them. This is a big problem. First point, I am disappointed with the PA on public health delivery because you have not talked about the core issues. You're just rehashing all issues. Number 2, manpower planning. It is interesting that the PA says we know there is a lack of manpower and the administration knows, I believe, that there is the aging of the population in the next 5, 10, 20 years. We need a lot of medical services so that people will age healthily. You need to do manpower planning, but then you only said briefly that there will be a review committee and hopefully there will be a report coming out, and then you say you know that there is a lack of nurses, but the hospital authority will continue to train nurses. But this is against the broader direction. In the past 25 years, most nurses have been trained in universities, but this time around you say the hospital authority will train nurses. So does it mean that you are proposing a makeshift solution because you know there is a lack of nurses? And that goes to show that the administration or the bureau are not making manpower planning in the nursing and public health sector. We always talk about having indicators of our manpower situation, but you never look squarely at it. In the private sector, there are indicators, but not so for the public sector. So how can we position the public and private sectors? And in the end, the entire primary, secondary, and tertiary healthcare system will not be properly positioned, but you are not doing it. You just say that the hospital authority will train nurses. The sector is disappointed and you have not done anything about this.
Now, this rush approach, they just asked the housing authority to train, the hospital authority to train a few nurses and that's it, instead of increasing the number of subsidized university places. Is that what they plan to do? And that's it. Now, if I remember correctly, there's funding. There's not been any increase in funding for first-year, first-degree places. So the government's not doing that. Is it just making minor fixes here? It's obvious that there is not a long-term planning. And how could it support the policies formulated? I think it's really disappointing. In this policy address, we don't see something else. Now, right now, some resources are not put to proper use. Now, why am I saying that? When you walk on the street or when you take an MTR, you see people have their heads down, you know, they attack zombies, there are plenty on the street. And then what sort of problems they have? Neck pain, shoulder pain, and so on. So if you do not try to promote good health, then people may have to go and see the doctor. And Dr. Ko, you were also pediatric surgeon yourself. Those people might actually come to see you. Now, I think it was in 1993 we had the registration system for chiropractors, but chiropractors are not in the public health system. I remember in the 2008 term of government there was mention of it, but for various reasons this professional discipline of chiropractors has not been introduced into the public health system. Now there is a shortage of orthopedic orthopedic surgeons, physiotherapists. Can we do something here? It seems the government is rather short-sighted. It's not making use of existing resources properly. Because then, you know, with chiropractors, we could shorten the waiting time. Now, for chiropractors, they would like to make a contribution in the public health system. But actually now, chiropractors couldn't even issue a medical sick leave certificate. I think it's rather disappointing. So can you consider using existing resources properly? And then you could help to shorten the waiting time in the public health system. I think the government should look into that. The policy address mentions a Chinese medicine hospital. Now, since 1997, friends from the Chinese medicine sector have been waiting for this hospital, but then there are no details in the policy address. Now, would it be Western Chinese medicine collaboration, or would it be not under the hospital authority? There will be a new setup. Now, this hospital will bring hope to the sector. On healthcare services, the policy address only creating hope. So the TCM sector thinks, oh, there's hope, but we're going to have a hospital and we can train more Chinese medicine practitioners. But then maybe in a few years, their hope will be dashed and the TCM sector will be let down again. I hope that in the policy address debate, you can explain exactly what you plan to do. Don't let the traditional Chinese medicine sector down again, because TCM students may say, well, there are good prospects studying TCM, but at the end they find that they could only work at herbal shop, Chinese medicine herbal shop. And the policy address has proposed a colorectal cancer screening. That's good. We welcome it. But again, there's no substance to the proposal. Now, the secondary level of screening is the high-risk group. That is a male after the age of 45, like myself. We are in the high-risk group. Now, it's good to do screening for them, but there has to be proper follow-up facilities. For example, let's say you just spend $10 to buy this test paper and check your feces and see whether you have cancer. But then after that, what would follow? You know, with this kind of screening, are you saying that if people are screened in, then they would then have to go to a private doctor? So you are trying to favor private doctors. Now for people, but then there's another high-risk group, those aged 60 or above. What about them? Now, it's a good idea to have screening, but when you consider the specifics of the scheme, please think through it carefully. Otherwise, it will be just another letdown, the screening program. Now, there's mention of secondary and tertiary healthcare, but primary healthcare is the most important. That is promoting health and health education. There's no mention at all. Perhaps 2 weeks later, the budget may talk about giving funding to the Department of Health, but the Department of Health plays such an important role. It takes care of the health needs of at least 6 million people in Hong Kong. There's no mention at all. Do you think you're doing enough, or you just want to ignore that? I think, again, this is disappointing. So, Secretary, in the policy agenda, I think you should look at this. And I'm still on healthcare. I'd like to talk about the needs of rare disease patients. The government's never paid much attention to that. What do you mean by rare diseases? In Australia, Singapore, Taiwan, European Union, rare diseases means the incidence rate is extremely low. These diseases are rarely seen. The World Health Organization is also given a definition for rare diseases. While the Secretary might say that different countries have different definitions, I agree. But in Hong Kong, there is not even a definition. And there's a group of patients with rare diseases. You know, fibrosis and all sorts of odd diseases. But we don't know how many such people there are, because there is no definition for rare diseases. If something is something wrong with these people, the government just wouldn't care about them. Now, I think after next week, that will be the first round table meeting for this group. They want to tell you what they need. So I hope the government they want the government to recognize their needs. Now, you may say that something has been done in the past, but like what? That is, they will look at each case. If there is this particular disease, and then let's talk about what sort of drug subsidy we could give, and then maybe they come to the complaints division of LegCo, and then they will start a file on this particular type of disease. But then there are patients with various kinds of rare disease. They need a government policy to take care of that, because drugs may be expensive, and some pharmaceutical companies may not even be interested in researching and developing such drugs. So I'm sure Hong Kong people won't be against you using public money to help this group of people. Unfortunately, in the many policy addresses, no mentions ever been made. Even in this policy address, there's no mentions. I'd like to raise this issue. I'd like to put it on record. I think you should consider a policy for this group of patients with rare diseases. At least you should gather some data to see how many such people there are in Hong Kong, what they need, and then eventually you could address their health needs. Also, it's equally important that you also consider the needs of the carers of these patients. So that's all I'd like to say on healthcare. Now, I'd like to turn to elderly services. Elderly services, of course, related to healthcare services. Now, of course, when we age, it's not true that then our engine breaks down, so to speak, but then at least our engine will go more slowly. Everybody would have some sort of pain or other as we age. So in taking care of the elderly, it's about just giving them enough resources, giving them a shelter and care. Taking care of their health is important. That's why I support the government, welcome the government's proposal to increase the healthcare voucher amount to $2,000. But then there are about 110,000 elderly persons who've used up the voucher that costs $560 million. Most of them, they spend it on seeing a doctor or a dentist. But when previous governments introduced the healthcare voucher, the idea is that apart from using vouchers for treatment, we want to encourage the elderly to receive primary health care. So you should, as you increase the amount, you should step up publicity. So elderly would use the healthcare voucher for primary healthcare services. For example, they could visit a dietitian to see what is the right diet for them, or they could go to dermatologist or chiropractor and see if there are ways to slow down the aging of the bones and so on, and joints and so on. So it's not just about increasing the amount. There needs to be more publicity. Perhaps the Department of Health needs to do more. Healthcare voucher shouldn't just be about seeking health services. It's about caring for health as well. Dental service is a disappointment here. In elderly care homes, there is service, dental service for elderly. But then how many old people actually stay in residential care homes? How many stay in their own homes? For the majority of old people, they stay in the community. They're not in institutions. So that means a large group of old people has not been taken care of. But then you may say, well, there is the voucher system now, which the amount is increased to $2,000, so they could go and visit a dentist. But $2,000 is not enough for tooth extraction and a replacement. So far, the government couldn't explain why. You could not extend or enhance the current public dental service, so you could also take care of old people. Well, young people is fine. They can go to private dentists. But for elderly people aged 60 or 65 or above, you help them get dental checks, and if there's tooth extraction, then you have to give them a denture. Now, for old people, age 60, 65, when there's something wrong with their teeth, if they don't address that, then when they grow older, they'll have problems with eating. And when old people can't eat properly, that leads to a lot of problems, about nutrition, digestion, and so on. This has all to do with health. So the government mustn't be short-sighted. You mustn't think that, there are not enough dentists or clinics. But the primary level, if you do a proper dental care service, then for these old people, age 60 or 65 or above, they will benefit from the service in future. They won't need to come back to take up resources in the healthcare system so much in this respect. So please consider it. I don't know if the Financial Secretary has heard me or Chief Secretary. Let's see if in the upcoming budget you could give some funding to expand the public dental care service to cover old people with needs. You help them with dental examinations, give them cheap denture and so on, so they can afford it. So this is important. It is about aging at home. The $2,000 voucher, only people aged 70 or above could get it. What about the other group? There's a void here, it seems, and you have not considered it. I hope you will do a better job, therefore, with the voucher system. Now, in the policy address, it's said that there will be a breakthrough. There will be 2 residential care homes on the mainland, and old people may choose to go there. I think it's a good idea. I think over a decade ago, I went to these 2 homes. Not too long ago, I revisited the Chun-yan home. The environment is really good. And I talked to the old people there. They said the only problem is that when they go and live in this Chun-yan home, if they have to come back to see the doctor, it's a lot of trouble because they're old, they can't move around so well. So it's only yesterday at the university meeting I said that nowadays technology is so advanced. There is this kind of device like a booth, and people can see the doctor electronically. This way they don't have to travel all the way back to Hong Kong. So please don't otherwise, old people might be deterred from going to the home in Shenzhen, but Shenzhen is doing the Shenzhen home is good. Actually, originally homes only take in mainland residents, but now they need to stay in business, so they also take in Hong Kong people below. So this is a good initiative. Don't waste it. Of course, in the elderly care service sector, there's not enough manpower. Now, there could be different levels of staff. We don't need only just professionals. And this, with the proposed scheme, hopefully we could attract more young people to the trade, and they could also do further studies. Here I have to declare interest because that's what my university is doing. But I think what is most important is that this scheme will let young people see if the elderly care service suits them as a career. But of course, the secretary will have to consider their career prospects and so on to see what you can do more for them.
As for the community care voucher scheme for the elderly, it is of course very good. I did hear that that's very helpful to assist elders to age in place. However, should we just stop at the scheme? That is, we can deliver meals to you, we can help you bathe, we can cleanse your floor for you, etc., etc. Should we stop at this? No. For those elders with heart diseases or diabetes, they can take care of themselves to a certain degree. However, we're not just talking about physical care. We have to make sure that they take medicine on schedule. They should undergo certain assessments, etc., etc. So for community care, we're talking about different levels of care. NGOs, when providing services, should be clearer about their positioning so that they can do community care better. We have to make sure that they can help the elders such that the elders can age in place. That would be better. Besides, I'd like to turn to a taboo for Chinese. That is hospice care. In fact, nobody can escape this final station. Many elders would like their final stop to be the home, not hospital. And of course, the Bureau Director would not like all elders to pass their hospice period in hospitals, particularly in this winter period is so cold. There are so many patients in the hospitals. Starting from 2009, we've got a hospice care scheme for the elders, for the chronically ill, the terminally ill. They may need regular visit from healthcare workers who will conduct checks for them and carry out assessment or do some pain-killing steps for them, such that elders can pass away in their own homes. Newspaper reports did say that many famous persons did that. Elders would then be able to happily and peacefully, in the company of family members, pass away in their own homes. Then they don't need to call ambulances to go to hospitals, and after suffering much, they return home and then go back to hospitals again. So, whether or not hospice care is given at home or in hospital, the support services are not enough. For Fung Yu King Hospital and Tunghua Group of Hospitals, in their elderly homes, they can provide such care. Very often, support services have not been enough, so the elders may have to be delivered to the hospital eventually. But autopsies might have to be performed if the elders do not pass away in hospitals. So, Bureau Director, if we can expand the scheme, then elders not just can age in place, they can also go through their last journey at home peacefully. Then they don't need to go to the hospital and suffer much before returning home. So we would like the scheme to be able to assist the elders as well as their family members. Finally, I'd like to say something about healthcare for the ethnic minorities. Well, again, I'll be repeating myself. But the policy address does not mention this. It's not just the healthcare for ethnic minorities, but healthcare for the elders of ethnic minorities, that is elderly ethnic minorities who have their own needs. The Bureau Director expeditiously gave us a reply lasting 7 pages. Councillors mentioned healthcare needs of the elders, for example, interpretation service, cultural needs, etc., etc. All these have not been addressed in that paper. That's disappointing. So when implementing the initiatives in the policy address, the Bureau Director should see to it that the elderly ethnic minorities are well taken care of. Well, I have 2 minutes left. I'd like to say something more about the elderly. That is about impetus given to the elderly. Well, we talk about silver hair impetus, silver hair activities, programs, etc., etc. Well, for the aged, if they reach 65 years old, even after retirement, they can still release their working potentials. The Bureau Director should see how to help them. For the healthy elders, they can take care of babies. They can assist the more elderly to go to clinics and hospitals. We should release the working potentials of the silver hair community. Then they can help themselves as well as others. Thank you. Mr. Lee Cheuk-yan. Thank you, President. In this session, we see both the Bureau Directors and the principal officials. Labor policy, population policy, and poverty alleviation are closely related to one another. If you launch policies in a fragmented manner, that won't work. you have to solve the problems comprehensively. But all along, we're told that policies would come on stream just like the poverty alleviation policies. But you have to resolve the problems of the working poor as well. Let me give you an example. We're concerned, the CS is concerned about demographic problems. Why are women not giving birth to babies? But there are a lot of problems. Any time for giving birth to babies? Any time to take care of babies? We're not just talking about 1 year or 2 years. We're talking about the whole life. Any time, any money, any place. 3 issues. And all these 3 issues involve other policies. Any time. What about our distribution policy at the moment? We always mention first distribution. In terms of distribution of resources for the labor sector, our wages have never been able to catch up with inflation. Time? No standard working hours. Place? We have housing problems. The CS asked, why don't the women come out to work? But our childcare services are insufficient. It's not for you to choose the time to work. Once you come out to work, it's not a question you work 5 hours, 6 hours, or 8 hours. If your boss asks you to work 10 hours, will you say all right? If you say not all right, then bye-bye. So, time is also a problem. Time and space are problems. That's why women cannot come out to work. Oh, why poverty? We all understand that we're talking about working poor. The SMW is not reviewed annually, so people are poor. The other day we asked Matthew Yiu-chung. He said at the end of the year we'll conduct a review. That means the 1st of May next year. That means biannual reviews. So people are poor because wages cannot catch up with inflation. And then the government has to subsidize them. Oh, I agree that we should subsidize them. But if you do not do both, then the government is tantamount to an unscrupulous employer who refuses to increase wages and salaries. So all these are interrelated. All right? Elderly problems plus poverty. If there's no universal retirement protection, then with just $2,200 will not allow the elderly to save up enough money for their twilight years. MPF, not in order. Income is limited. And in a moment, I'll do some calculation with Matthew Yiu-chung about the offsetting of LSP and severance payment. Now, it's very clear. All these are interrelated. You must adopt a comprehensive approach, otherwise it won't work. The Liberal Party and the CTU are very good at making proposals to make people live better. So we always emphasize a comprehensive policy, including a retirement policy. All along we've been striving for universal retirement protection. And now we're waiting for Professor Nelson Chow's report so that we can thoroughly resolve our retirement problems. Well, after Professor Nelson Chow submits his reports and recommendations to the government, what will the government do? We don't know, and we don't even know what Professor Chow will give you. Now, I'd like to turn to the debts borne by C.Y. Leung. Well, Bureau Director, the offsetting issue for MPF and LSP and severance payment must be addressed. Most employees are in the middle class. Our MPF has an offsetting problem with the LSP and severance payment. Now, Li Wai-ling is a new case. Will there be offsetting? between MPF and LSP and severance payment. You see, day after day, employees are laid off, etc., etc. $2 billion per year, accumulating to $20 billion for so many years. That is to help the employers to pay the severance payment. Well, you will tell me, back then, it's the LegCo that passed it. Well, I moved an amendment then, but lost. From the year 2000 to now, how many years have passed? The LegCo passed that before 1997. 20 years have elapsed, and even after the particular motion, 14 years have elapsed. Well, C.Y. Leung has to pay off his debts. That's the first thing he has to do. In his manifesto, he said that he would gradually abolish the offsetting policy. We thought something new would come out, but the 4 major chambers of commerce and trade associations came or went to talk to C.Y. Leung, and then he dare not say anything. And then he said that even if he does not mention that, it doesn't mean that he's not going to do anything. Now, he said studies would be conducted, a comprehensive approach would be adopted. It's very complicated. How complicated? It's controversial, but it's not complicated. The question is, dare you touch one hair of the business sector? If you dare to do so, I'll kneel in front of you. For the 689 votes for C.Y. Leung, most of them were from the business sector. Just admit it. Don't pretend. He promised something, but did not honor his promise. Well, this is something very big for the business sector. $2 billion per year, only to be paid at the time of layoff. We're not asking you to distribute that money to everybody. We're just striving for what the employees deserve. For previous years of service, we're not asking for offsetting because we cannot pursue that any further. But now our employees are entitled to all their severance payment. I'm very fair. I'm not asking for retroactive effect. But the government only said that studies would be conducted, no timetable, no route map. This is regrettable. It's regrettable that the FTU has deleted the word regret from my amendment. The FTU says that it would stand firm for the employees. Well, they stand firm, but their hands were soft.
Once they press the button, they get soft-hearted. And they actually crossed out the word regret. This is not the first time they have done it. They did it last year. I am repaying the debt. No, I ask you to repay the debt. Not just 1, but 2. I have to chase up CY for 2 debts, and also Mr. Matthew Chung. I am not even talking about standard working hours. Later on, the bureau chief will say that you have a committee working actively on standard working hours, and there will be a report by the end of the year, and then you will look at the future direction. But I remember very clearly that you have been twisting us around your little finger. And then by the end of 2015, you have the report. And then in 2016, there is election. In 2017, if C.Y. Leung has the luck, I hope I'm wrong in my predictions, theoretically, C.Y. Leung will step down in 2017. You are wasting 3 years. There will be the study, but in Donald Tsang's era, you already studied the issue, and now you are conducting more studies. It's meaningless. You are just dragging your feet. Why won't you do it? It is because the business community doesn't like it. When the businesses don't like it, you surrender, and that's the end of the entire matter. So you can see that retirement, MPF, and I have to chase up the debts, and also population policy, and I'm talking about standard working hours. If you don't resolve that, women can hardly work in society because working hours are not dictated by women but by bosses. even you provide childcare services, after school, nursery services. Of course, we are asking you to do that. We have been asking the Bureau Secretary to do a better job, but he came to the LegCo saying that there will be more community nannies. But I just don't understand why you want to ill-treat the women, in other words, community nannies, that you're not paying them. If there is no employment relationship, there is not even employment insurance. Even if they are injured at work, they will not be insured. You have the money, but why are you so firm on these matters? Why don't you regularize the subsidy for these people? And then you say you will increase childcare services and nursery services, etc. But in fact, there is nothing of the sort. If in your population policy you say you want to encourage 500,000 women to work, if you don't strike a balance between work and family, there is no way you can do it. And to do that, you have to tackle standard working hours. Even if you have childcare services, you are not going to do your job. But then again, you are cunning. You say, I have done everything. Allow me to import labor. This is a trap. Are you going to entrap us, Bureau Secretary? There is something that you clearly cannot do. You want women to work, but you cannot do it because you are not tackling the issue of standard working hours. You put up a show that you have done everything, and then you ask for importation of labor. I'm very worried, and therefore I say clearly that I object to importation of labor. This is because you're just putting up a show, and then after the importation of labor, there will be the suppression of wages. We are talking about standard working hours, but that does not apply to imported labor because they are compelled to do the utmost. And then talking about population policy, it is said that those who are over 50 years old should be able to work. And we are talking about 240,000 people who are between 50 and 64. They have the potential to work, but these people are not working. Now, of course, we encourage retired people to take up part-time employment and to choose what they want to do. However, if there is no law against age discrimination, then, as you know, Dragon Air is asking stewards and hostesses, air hostesses, to retire at 45. You say you cannot hire enough people, but then Dragon Air is asking or compelling people to retire. Cathay Pacific, people should retire at 55, and then other people can retire at 60 or 65 if you are not an air hostess. So why don't you tackle this age discrimination problem? And you only do superficial things. You do not legislate against discrimination, but you put up a show to say you encourage people to retire later. Last, I'd like to talk about the working poor. Just now I talked about the importance of the statutory minimum wage, but it's unfortunate that there will be a review only every 2 years. The Bureau Secretary said that he doesn't rule out an annual review, but it amounts to nothing. I have to continue to strive for annual review of SMW on behalf of the labor sector. Okay, working poor, you have the LIFA, L-I-F-A. I support that, and 10 years ago I started to talk to the FS about this. And indeed, this time around, Mrs. Carrie Lam, you are rolling out the low-income working family allowance. But when you have a good policy, I don't know why you won't go all the way. I really can't stand this 208-hour issue. In other words, you have to work 208 hours before you get full subsidy for the children. Of course, you say the difference is only $400, but you have the basic allowance, and then you have to work 208 hours, averaging out to 48 hours per week. In other words, you ask people to work 48 hours per week before you regard him as a full-time worker. That concept doesn't work, and there will be a lot of trouble when you vet the applications. Some people work 48, 44, and then 50 hours per week, and the working hours will be different from week to week, from month to month. If you draw such a strict line, then it's very difficult to do the vetting. Why don't you relax the criterion to say that if you work, say, over 100 hours, you will be able to get a full subsidy? So it lessens the trouble for everybody, including the applicants, and this has something to do with efficiency as well. I also have to pursue another debt. I have pursued the debts with C.Y. Leung. Now I am talking about Matthew Cheung. You owe me 2 debts. One has been owed for over 10 years, and that is the Labour Tribunal and cases involving discrimination against trade unions, and we say that orders should be issued to bosses to reinstate the workers after dismissal. You may say that the sin is not with the Bureau Secretary, but then it is with the administration. You said that the judiciary had a view, and then now we don't know when we will have it. But the judiciary gave its comment 4 or 5 years ago. We thought this would be resolved, but then suddenly this has come back, and there is more delay. We don't know when this will come to play. It was in the legislative timetable, but then it was withdrawn. Now we don't know when you will pay up that debt. Another one relating to women employment. Many women say, even if I work, I would only be working piecemeal work. Now you have to work 4 weeks in a month with 18 hours at least in a week. But then it doesn't mean any protection for women. Very often, when women are employed, people would just make sure that they just work below 18 hours a week, including the jockey club. And employers can always make use of these legal loopholes. This is something that you really have to do something about. You cannot just sit with your arms folded like that. You say this is at the LAB and you are doing more studies, but we cannot see the resolve on the part of the administration to roll out a legislative amendment to protect these part-timers comprehensively and to do away with the so-called 418 criterion. And at least they should be given proportionate protection. So I am pursuing this debt with you, Mr. Matthew Cheung. The conclusion is simple. Under the population policy and also labor and also poverty alleviation, if you only tackle them as isolated issues without linking up the issues together, if you dare not touch the business community at all, then in the end there will be no effective policies that can be made. In the end, people's livelihood will not be improved. Thank you. Mr. Christopher Cheung. Thank you, Mr. President. The PA states from the outset that we should support the needy. And a lot of resources will be mobilized to roll out a series of poverty alleviation measures and also to support the grassroots. In terms of poverty alleviation, you are going to really plow in huge resources. We can see that he has the commitment and determination to do something for the public and also to tackle this social problem of the wealth gap. A $3 billion LIFA scheme will be rolled out. So 200,000 households, which has an income below 60% of the median household income, will be benefited. And the household can get at most $2,600 in subsidy. But what is more important is that the government does not only give money, but through the subsidy, it is proposed that low-income families should be encouraged to work and be self-reliant. They have to work diligently before they can get the subsidy to improve their lot. The application details have not been issued. We have to wait and see whether this will be an effective policy. At the same time, 7 programs under the CCF will be regularized, and 3 of them have to do with the support for students. And 270,000 students will stand to benefit. Primary students who get a full subsidy will be given a meal allowance. And those who are eligible for textbook allowance, those who study in secondary and primary schools will get 100% more the standard payment. And those who are studying courses under the sub-degree level, and if they are poor students, they will be assisted with school fees payment as well. This is very good because poor students will be taken care of. Mr. President, I am aware that the CE will be doing a lot for education. Vocational training and education will allow youngsters the opportunity for upward mobility. As I said yesterday, we must work for economic development and find new ways out for our economy so that grassroots and young people will be able to put what they learned into practice and see a future. because of this series of poverty alleviation measures, and it is said that $10 to $20 billion would have to spend on it. The public have shown concern, and it is said that there could be long-term financial pressure on the part of the administration. But it is good that there has been recent clarification that the series of poverty alleviation measures would only cause an increase of $7 billion in expenditure. Given the present financial situation, I believe that is affordable. The CE and the FS have said that the administration will not be increasing taxes. The public, however, are concerned about welfare expenditure and whether it will snowball. And the administration is now looking into universal retirement protection. What proposals will be made in the report? Will it lead to a huge increase in government commitment? Will there be a case of the government not making ends meet, whether taxes will have to be increased? All these are our concerns. Mr. President, I am aware that many middle-class people have some views about the PA not giving them any support. It is said that you are only favoring the grassroots and not taking care of the middle class, and they are disappointed. The CE says that he is grateful to the middle class for their contribution to Hong Kong, but I believe the administration should really do something to show you care about the middle class and let them understand that they are not neglected by the administration. They have been working silently. They are the pillars of society. How can you just leave them like that in their plight because they work a lot, they pay taxes, but they are not getting any benefit? I hope the FS will continue to provide some favors and relief to the middle class in your budget. For example, tax concessions and also rates, allowance, etc. Mr. Ronnie Tong. Mr. President, starting from the time C.Y. Leung ran for the CE post, he gave people the impression that he would do a huge lot for the poor. And the trump card in the PA is that it has been leaked, of course, before the PA was announced that there would be the LIFA. This is something good, Mr. President. I don't want to belittle the efforts of Mr. C.Y. Leung in this respect. It is an improvement to our policies. But if we look closely at the lever, you will see that, well, it is still fraught with a lot of loopholes. What do these loopholes show us? I'm afraid that that the policy improvement is not out of concern, but it is just to make a good show of what you are doing for the poor.
First of all, the scheme doesn't benefit individuals. I think that's an unforgivable mistake. Single persons who are working and who are in poverty, yes, there are many of them, but how many really? And how much are we? Will it cost us? Why don't we help them? You know, singletons living in caged homes, in subdivided units. They have no family. They could only afford one meal a day. Why can't you help them? I really don't understand why. Now, if you have any compassion at all, you are not going to be stingy about this small sum of money. And even if they have a family, they have no children, you're not going to spend much more. Because based on their old proposal, for a two-person family, 50% of median income, that's just about $600 to $1,000. You can get that even under the Work Incentive Transport Subsidy Scheme, which is more than that, actually. Or if your income is a bit higher, it's worse off for you. Then you just get $300 to $500. It's like just handouts. It's like charity. Yes, C.Y. Leung is doing something good here, but I'm not completely convinced yet that he truly cares for poor families. His proposal is half-baked. For those most in need of help, he ignores them. And more importantly, it's about alleviating poverty. It's not about charity. It's not just about giving them a few $100s a month and then the problem is solved. No. We all know with poverty alleviation, the most important aspect of this policy is about promoting upward mobility. Now, I've said this more than once in this chamber. You know, in our times, President, in the 50s, 60s, there was upward mobility. Not much, but there was at least. But in the past 10 years, it seems there's no more upward mobility, but rather there's downward mobility. Middle class becoming grassroots sector. Why is that the case? The best way to lift people out of poverty is to allow the next generation to be upwardly mobile so they could then help their families. So I'm sure you've watched interviews on TV. The people's response to the policy address that all I want is that my children would not be like me. Why can't the government even do that? So shouldn't we ask the SAR government to put more resources into tertiary education? Especially you should help the poor. I've said this to the Chief Secretary many times. She seemed to agree with me. Can we have consider the policy of Hong Kong U, the first in the family policy? That is, if the first child in the family is able to go to universities, a subsidy could be given so he could take up university education. But no, the government's not doing it. And now on assistance to tertiary education, paragraph 96. Here we're talking about an additional of 1,000 units over 3 years. So that means every year is just 300 odd units. You look at our universities. First of all, do they have the capacity to accommodate more young people? Currently, they do not have the capacity. Now, for many local universities, especially the Hong Kong University, they need to break even, so they are taking in a lot of mainland students. For local students, if your family is well off, you can send your children overseas. Now, I'm lucky enough to be in such a position to send my child overseas to study, but many families could not afford to do that. So why can't you do more here? Now it says here you will study the feasibility of a new scheme. Again, it's just to study. And point 3, a mainland university study subsidy scheme will be introduced. That means you could go to the mainland to study. But why don't you let them stay in Hong Kong to study? Why can't Hong Kong take care of them? And then point 4, a new scholarship scheme will be implemented to support up to 100 outstanding local students each cohort to pursue studies in renowned universities outside Hong Kong. Again, it's the same question. Why can't they stay in Hong Kong to receive education? Then they could immediately contribute to society. And point 5, for 20 local students who excel in sports, arts and community service, they could be given a scholarship. Yes, that's good. I support this idea. But still, the overall problem remains. I hope the SL government would have the determination to do more good. Now, on the one hand, we see that C.Y. Leung is doing a bit in poverty alleviation, and then immediately the financial secretary comes out to say, well, we're going to use up all the money. Maybe we're spending too much on poverty alleviation. Well, he didn't say that, but that was the undertone. That is, poor people are spending too much of our money. Very soon our money will be used up. Why do you want to create such social conflicts? Why do you try to put the blame on grassroots families? Is there really a need for the financial secretary to come out and say something like this? Are we talking about a lot of money here, really? And if you say you don't want too much recurrent expenditure, you want one-off expenditure, why don't you give money to the universities? To build more universities. Donald Tsang talked about building 3 more universities. Where are these 3 universities? So can you give out a loan to build 2 more universities so you can help Hong Kong people, you can help the next generation? So having read the policy address, I still feel disappointed. Yes, some good is being done, but not enough good is being done. Thank you. Mr. Wong Kwok-kin. President, in helping the poor and supporting the elderly, there's a lot being said in the policy address this year. It will benefit the disadvantaged and the elderly. The low-income working family allowance has the support of many in the community. Some 700,000 people could benefit from the scheme, and it involves $3 billion in expenditure. In elderly care services, he said there will be review of new service delivery model, and there will be medium to long-term plans. So compared to the last policy address, this one has more of a vision, and we can see the sincerity of him trying to resolve problems. That point is for sure. Apart from giving low-income working family allowance to poor families, in terms of helping the poor and supporting the elderly, for the first time the government is proposing to buy places from residential care homes on the mainland operated by Hong Kong people. So there's one step moving forward in the right direction, and we welcome it. Now, portability of welfare services is something that elderly people have been asking for a long time, because it will give them an additional choice, and that means a bit more protection. We cannot overlook the population aging problem. It's estimated by 2041, in every 3 persons in Hong Kong, 1 would be over 65. So with an increase in the elderly population, of course, there's need to do more in planning elderly services. Some time ago, the Commission on the Elderly pointed out that with rapid aging of the population, there is need for the government to consider mainland services in its elderly service policy, because if we just rely on the land in Hong Kong and the services in Hong Kong, there could not be a good future for the elderly. So I think it's because of the future issue that led the government to buy home places from the mainland. But is it enough to address the elderly issue? I think elderly people want to stay where it's convenient, they could see their family members. They want to live in an environment like that. It has to be the last choice for them to want to move to a home. Many elderly people have relatives on the mainland, so they go back to the mainland for retirement. It's rather usual. But in recent years, of course, commodity prices have soared on the mainland, and with appreciation of renminbi, now people have to struggle a bit staying on the mainland. Some could no longer afford it. Perhaps there's a major illness. They've spent up their savings, so they are forced to come back to Hong Kong. We have 5 service centers, of the FTU on the mainland. We know that there's a trend of elderly people coming back to live in Hong Kong. Since 2006, 649 elderly persons have come back to Hong Kong. And among those coming back to them, more than 80% of them came back because of financial difficulties. And the latest information also shows that in 2013, there are some 7,000 cases of elderly people, Hong Kong residents in mainland seeking assistance from our service centers. That's an increase of some 50% in terms of elderly people seeking help because of financial reasons compared to the year before. So elderly people want to enjoy retirement on the mainland, but they are not entitled to welfare on the mainland. But then when they move to the mainland, they are no longer eligible to welfare in Hong Kong, so they have no support. The service centers of the FTU have been striving all these years for the Hong Kong government to give the welfare services to elderly people retiring on the mainland. So it's about portability of welfare. Finally, this year the government has introduced the Guangdong scheme. So for elderly people who have moved back to the mainland, they are entitled to the fruit money. In the policy address, the chief executive said that he would consider extending the scheme further, and I welcome that. I'm sure this measure would help elderly people to address their immediate needs. Well, the Guangdong scheme has only been in place for 3 years, but response has been good. And it's also obvious that this year there are fewer elderly people coming back to Hong Kong for retirement. If the Guangdong scheme could be extended, it will help to alleviate the financial pressure on elderly people further. So it's hoped that you would consider extending the scheme to provinces like Fujian. Now we want to make elderly people to enjoy retirement on the mainland. We have to consider a number of factors. Care home places and subsidy. Of course, elderly people have healthcare needs. This is also important, or even more important. So for the elderly healthcare voucher scheme, it should be extended to cover elderly staying on the mainland. Now, I'm sure for every elderly person who is forced to come back to retire in Hong Kong can tell you a sad story about the difficulties they face in getting health care. I hope that not too soon, Hong Kong elderly people living on the mainland will receive the same health care as those staying in Hong Kong. Now, whether elderly people choose to go back to the mainland depends on, to a large extent, on the quality of healthcare services they could receive. Now, it's not just about outpatient service, it's about surgery and follow-up treatment and so on as well. So the government has to consider all the needs of the elderly people before the government could actually come up with a proper plan to, which is a portable plan for elderly to take their wealth with them anywhere. Now, with such a policy, it will offer immediate protection to elderly now staying on the mainland. And then with a properly developed portability scheme, elderly people will have an additional choice as they retire. Now, there's been attack by the Labour Party, Cheuk-yan. I find it odd. Every time when Cheuk-yan speaks on labour issues, he would attack the FTU. I wonder why. Is it because you scold people loudly that means you are right? Does it mean that because you're loud, then that means you have made an effort? Well, we should talk about facts and reasons. The statutory minimum wage now in place. Who forced the government to implement it? The Donald Tsang government, or when Donald Tsang ran for election, Chen Yun-han of FTU forced him to agree to a minimum wage protection scheme with her vote. And that eventually led to statutory minimum wage. Who forced C.Y. Leung to include standard working hours in his election manifesto? Everybody knows it's the FTU.
Who first chased after C.Y. to ask him to honor his election pledges? That is, to abolish this offsetting mechanism for MPF, LSP, and LP, or severance payment. We've done a lot quietly. We worked hard together with the labor sector. As for unreasonable attacks from outside, we have to make it clear that some people speak very loudly without doing anything. They criticize others such that people will think that they've done something, but others have not. Such behavior is not desirable. The labor sector should be united to uphold our interest in front of the business sector. We should not try to accuse one another by claiming credit. We should force the the offset mechanism under the MPF, we should work hard together and shouldn't criticize one another. Why do we delete the word regret from Mr. Lee Cheuk-yan's amendment? It's because we're of the view that this policy address of C.Y. Leung is desirable in certain areas because he has proposed breakthroughs. For example, long-term measures have been proposed to replace one-off candy distribution, and he has taken a big step forward in terms of welfare services to the grassroots, to the disadvantaged, to the elders. All these are very beneficial. If just because of one aspect we reject the whole policy address, it is unfair. So we'll continue to pursue C.Y. Leung to pay off his debt, that is to abolish the offsetting mechanism under the MPF. However, we won't reject the whole policy address. That's why we've deleted the word regret. We'll support the original motion. Thank you. Mr. Poon Siu-ping? Sorry, the speaker is not speaking into his microphone. Mr. Poon, have you already put on your microphone? Well, I've already clipped it very tightly to my lapel. You couldn't hear me? President, in this year's policy address, after the CE released his policy address, I was in a dilemma. Something is lacking. That is, there's no proposed abolition of the offsetting mechanism under the MPF. I'm disappointed. However, there's this low-income, poor working family subsidy. This is the first concrete measure for long-term commitment for the poor families in order to improve their living. Although this policy address is very much different from what I expect, I still have expectations. Last October, when I offered my suggestions to the CE for his policy address, I sent him a written submission proposing a household scheme for poverty alleviation. For example, if the household income falls below 50% of the median wage, then family members should be given a 5% subsidy. For the individuals, for those earning less than 50% of the median wage, he is entitled to full work incentive transport subsidy. And there shouldn't be any means test for these. As for the government proposals, something can be discussed. In discussing assistance for the households, the government has insisted on a means test, saying that that is to ensure that resources are effectively used. But that's not the fact. For preschool education, for first-degree places, for medical and healthcare services, for the proposed doubled allowance for the healthcare vouchers for the elderly, there are no means tests. Now, all these are immediate examples. Why is it that low-income working poor families have to undergo means tests? For CSSA recipients, it is necessary to have a means test because CSSA is a safety net for those who cannot sustain themselves. But this low-income working poor family subsidy is completely different from the CSSA scheme. The government encourages households to save money for their retirement. At the same time, it has rejected the poor households. There is a policy conflict here. The government suggests that the means test for PRH should be used. Now that is a rather relaxed arrangement. I believe the majority of low-income families will be able to benefit. The question is, can the government be more open-minded? That is, to do away with the means test and just make use of the household income as an assessment criterion. That is, to encourage household members to go out to work and save costs. In the policy address, while proposing the scheme, nothing is mentioned about its relationship with the work incentive transport subsidy scheme. It's only in the policy agenda that we see a comprehensive review for this year. Our former colleague, Ms. Li-feng criticized a great deal the government's policies. After the policy address has announced poverty alleviation measures, the work incentive transport subsidy scheme should be very dedicated in its target recipients. And then, what's meant by employment and subsidy? We must have clear definitions. According to media reports, if an applicant works for at least 208 hours, it would get a basic allowance. Between 144 and 208 hours, a subsidy of $600 would be paid. According to the Labor Department's report, in 2011, for those working, the average weekly working hours is 44.2. Every month is 180.2 hours, not reaching 208 hours. So, for the low-income working population, even though they work 208 hours, the labor market may not be able to provide sufficient jobs. And then, while encouraging a 5-day working week, the government is asking these people to work 6 days a week and 8 hours a day before they can be entitled to the allowance. That is unreasonable. According to our labor laws, if you work 4 weeks a month and no less than 18 hours per week, you meet the requirements of being employed and be protected by our labor laws. At the moment, this is also the fundamental principle underlying the work incentive transport subsidy scheme. And in the Labor Department's policy study report, part-timers are defined as those who work less than 5 days a week, or less than 6 hours per day, or less than 30 hours per week. The continuity of employees as well as standard working hours are defined differently, even under the Labor Department. In society, we're discussing to legislate for standard working hours. Therefore, the calculation of working hours is very sensitive. Therefore, the government must be very careful in delineating standards for part-timers and full-timers. Ms. Li-feng proposed 44 working hours per week as the standard working hours. That is the basis for our discussion. That is to set the working hours at a reasonable level. Under the scheme, the working hours of the applicant would be the standard criterion. However, that is really flexible. If a family member or family members in total work the number of hours and meet the requirements, they'll be entitled to the subsidy. This is to encourage employment and benefit poor families. The government proposes that there should be 2 tiers of benefits, $1,000 and $600. Every child in the family will be entitled to an extra $800. When compared with my proposal, that is 5% of the median household income, it's even more generous. Given our median range, in 2012 it is $28,500. Half of it is less than the proposal from the government. we should welcome the government's proposal. It is easy to understand the scheme if we peg it to the median wage. If the public coffers have further capacity to assist the poor families, I'll propose that 5% should be increased. We should not rigidly define a subsidy amount. We'll strive for the scheme to be implemented next year. But we don't know what the government means by next year, the beginning or the end of next year. If you count the beginning of the year, we still have 1 year to go. If it's the end of the year, then 2 more years to go. So we have to be clear about the target date. Before the implementation of the scheme, for the have-nots, they basically rely on the one-off living subsidy under the CCF, $7,000 for 2P families, 3P and above, 30,000. In order to assist the have-nots, the right prescription is to provide a housing subsidy. And for private buildings, residential buildings at a particular age, rental control should be imposed. That is to ease the living pressure on the have-nots. Another social issue, major social issue, is the aging population. In the policy address, a number of elderly services are proposed. For example, the use of private lots for welfare purposes. To increase the residential care places for the elderly. But after hearing that proposal, the government said that Cheuk-yan elderly home would be resumed for the purpose of Northeast NT development. I visited that elderly home. It's a very good community to let elders age in place. On the one hand, the government identifies land lots to build residential units. At the same time, it's abolishing this elderly home in Cheuk-yan. If eventually Cheuk-yan is to be resumed because of Northeast NT development, I would like the government to make one more step on private lots. The government would directly allocate land for such institutions, and the existing operators should be allowed to continue to operate their homes. The core issue here is not just inadequate places. There's a deeper issue, that is, the high rentals, thus adding to the burden of operational costs. Operators cannot make long-term investment. They have to save on many fronts, leading to a number of problems. For example, very simple facilities, poor living conditions, the low wages cannot attract sufficient workers, and so forth. $800 million have been earmarked for the next 3 years for residential care services for experiment service.
Private homes will have to maintain prices at a reasonable level, but they do not upgrade their services, and in the end, the elderly are not happy to patronize them. The health vouchers for elderly people are to increase from $1,000 to $2,000. Of course, that will be welcomed by elderly people who are over the age of 70. But those who are under 70 will not be assisted by any health vouchers. That is inappropriate. We need to consult a doctor when we start to become ill. We should encourage the so-called younger elderly to pay attention to their health. The policy is that you provide an elderly card to elderly people over the age of 65. If you regard those between 65 to 69 as elderly people, they should be issued with health vouchers as well, so they are encouraged to do physical examination and seek medical attention whenever they feel unwell, so that their illnesses will not become more serious. I will ask you to review the health voucher scheme and lower the threshold to 65 years old. And maybe you can limit the voucher value to half of the value for those over 70. The PA says that the administration would like to build a general hospital in Kai-tak and also a Chinese medicine hospital in Cheuk-yan in order to relieve the pressure on the public system. But to build new hospitals, you need to have a good complement of medical staff. I visited the new North Lantau Hospital. Because of a lack of manpower, some services cannot be started. You want to build new hospitals, but the premise is to make sure that you have enough medical professional staff. The PA makes no mention of this. There is no plan for the training of medical staff so that there will be long-term sustainable development in the medical system. Mr. Ka-piu. Thank you, Mr. President. The DAB has this comment to make about the PA. It has responded to livelihood issues, but it has turned in a blank sheet for labor issues. We should be talking about labor and manpower in the next session, but since the CS and the SLW are here, many members are talking about labor. Now, I'd like to concentrate on welfare and elderly services. For elderly people, I'd like to talk about care for them and also how we should help them in other aspects, and that has to do with the MPF. Therefore, I will be talking more about MPF, especially the Commission on Poverty under the CS has this retirement matters working group under it. Certainly, I will be commenting on the work of the SARG in this respect, and also we would mention again the FTU's recommendations to the SARG. We would hope that the budget will respond to these recommendations. Before I go into my speech, since many members have talked about the LIFA, and in fact I have received some submissions from organizations and they asked us to say this to you. When we started to have an exchange with the administration, and that is support for low-income families, the DAB or FTU actually has the same principle abided by the administration, and that it should be pro-employment and pro-children. It is clear that the information we have now shows that by and large you have achieved the implementation of that principle, but with regard to the actual number of hours to be worked, and that is at least 208 hours a week, I think that is on the high side. The FTU has always said that we would like to have standard working hours, that the government should play by example, and there should be 44 hours per week. But here it would average out to 48 hours a week, and we think it is on the high side. Unless in the end you want to make use of this 208-hour level to lead the community to say that starting working hours should be set at 48 hours instead of 44 hours. Now, if you admit to that kind of thinking, we'll have to debate it with you. But I do hope that before you come to the Legislative Council for funding support, please make minor adjustment to the working hour requirement. Some white-collar people may work 5-day weeks, and they may have a salary of $9,000 to $11,000 a month, and they may not have 48 hours a week. So please make minor adjustment to that. And also, you are not providing any particular concession to single-parent families, for example. And if a member of the family is receiving disability allowance, then would they have exemption vis-a-vis the working hour requirement? I think you have been silent on that. I heard that before you formally launch the scheme, you should respond to those issues. Last time, there was a motion debate about having a detailed discussion on low-income subsidy. I registered my worry. I said that with regard to the WITSS, we should learn from it. There are families which are eligible and they get $1,200 a month, and that is by no means a small amount, but they have to submit financial information about the entire family, including assets, and that prove to be some kind of disturbance to these families, and therefore they do not apply. In fact, you wanted to do this good deed, and why don't you relax the administrative requirements? As I said before in this debate, I can give you this example. You now make use of the asset limit for PRH applicants. Now, does it mean that existing PRH tenants can be exempted from assessment because they are in PRH? They have been vetted by the housing department. And also, if they are on the waiting list, they are in difficulty. Now, why can they stay in the waiting list? It is because their asset limit has not exceeded the level stipulated, and also they have a low income. So as long as they show you information that they are in the waiting list for PRH, then they can be exempted from this administrative vetting. Can that be done? Okay, for those who are not in PRH, those who are not even in the waiting list, they may be paying mortgage installments for their property, or they may be in rented accommodation, then you can turn your attention to this group. So you will reduce administrative cost, and then you will indeed be encouraging low-income families to work. And lastly, the FTU has been striving for having an SMW. Now we see the results. In May 2011, we started to have SMW, and low-income CSSA recipients, single-parent CSSA recipients, and they have been reduced by about a quarter. It is clear that when the market can provide relatively reasonable wages, the public are willing, and they are in a reasonable group. They are willing to work. But then what is sad is that the poverty rate has not indeed been lowered. In other words, they may leave the CSSA safety net. They are still poor. The CS may not say or may not commit that the scheme will actually do away with poverty, but I do hope that we can lower the poverty rate, and in a marked manner, or else you'll just be wasting your efforts. And organizations and members will just continue to criticize you that you're not committing to eradicating poverty. Elderly services, there is a lack of institutionalized places, and there is a lack of planning. As you know, I am the deputy chairman of the long-term care working group. We have been criticizing you on this, but the bureau chief will say no. In 4 years, we will increase the number of places by 3,000 plus subsidized homes. If they can be built, there will be an increase of 4,000 places. But these so-called places are not for real at the moment. I think you are taking reference from the concept of community care. In other words, different people will put in money, and there will be community care vouchers so that you continue to buy self-sufficient private places. I happen to talk to experienced social workers giving support to the elderly. Now, they are worried that, of course, the administration is now encouraging community care. You are starting to do it, and things are improving. But all of a sudden, you may issue these community or institutionalized care vouchers for 3,000 places, and then there will be confusion. So the experienced social workers were saying that later on the institution care vouchers should be dedicated to elderly people who suffered the most. Now, you know the ratio of 9 to 1. 90% have gone to nursing homes and 10% to C&A. Many elderly people have to wait 5 to 6 years before he or she can have a place in a nursing home of his or her choice. Now, he or she may have a strong need for nursing care, and yet they have to wait so long. So the consensus is that we should not affect community care development, but then we should concentrate resources to help these who have the biggest need for nursing care, so they get the benefit of the vouchers first. So first of all, you provide help to those who are most needy. And secondly, you can encourage the 500 odd private homes, including institutions which are self-sufficient and they are run by subvented organizations. I hope that they will be encouraged to provide better service. Since you have this system to help elderly people who have the greatest need, then if money follows the applicant, then only the nursing homes which provide the best service will be able to get the resources. So you encourage them to develop in that direction instead of having people continue to criticize that private homes in Hong Kong are of very poor quality. I sincerely hope that subvented homes need to do a good job, but even the non-subvented nursing homes should also aspire for better quality. Even if you criticize them, they will not disappear because the government's building program will never satisfy all the need. So you are going to roll out the community care vouchers, and I'm making this concrete proposal to you. I hope you will continue to talk to experienced social workers who help the elderly, so you strike a balance between community care and institutional care. Talking about private homes, in a previous council meeting, I had wanted to ask a supplementary question, but I did not have the time. By the end of, actually in September, there was news about a Shui private nursing home, and it was exposed that a worker ill-treated an elderly person, and that worker was convicted. But the whistleblower was sacked by the nursing home. If our society cannot protect these people, the SWD says you conduct surprise checks, but the workers are acting to expose these illegal acts, and yet you do not give protection to them. Then the nursing homes would think that there is nothing you can do about us. We can shut our doors and we can do whatever we want. And recently, you unilaterally announced that bought place scheme homes can import labor. Now, of course, you will say the bought place part will not be served by imported labor. But if they just close their doors and do whatever they want, there is nothing you can do about that. And then when the supplementary labor scheme will be importing labor, and if the worker thus imported would like to complain, what do you think will happen to him or her? They will be repatriated. And can you do anything about the working hours? I can see that under the supplementary labor scheme, very often the advertisements to hire people for private homes will look like this. On the face of it, they may work for 9 hours, but then they have a break of 4 hours in between. In other words, the total number of hours will amount to 13 to 14 hours. Now, can you make sure that the so-called break will really mean some rest for them, that the time is really for them to spend freely? No one can ensure that. As the FTU will always do, will continue to monitor whether you are going to continue to import labor. The SWD unilaterally announced earlier on that bought place scheme homes will be allowed to apply for importation of labor under the supplementary labor scheme. We think that is very regrettable.
We are also worried because you always say young people join the elderly care trade, bright prospects, but then you're trying to suppress wages. What you do is import more labor, and then you can suppress wages. That's how the way the market works. If they can't hire enough people, of course they have to pay more. But then in Hong Kong, if you can't hire people, you just bring in imported labor, then why do you need to pay a higher wage? And then employers don't need to consider how they could strengthen training or improve the work environment to bring in new blood. Because at the same level, they could just say, okay, we couldn't hire people, so import labor. So you're saying that it's so difficult to hire people in the elderly care sector. There are 1,200 what we call PWs. you've asked them to move from youth service to elderly care services, and the response was poor. It's because you try to suppress wages. You import workers, and as a result, you are stopping any improvement to wage level and so the work environment. So you have to reflect upon this. Now we're talking about the aging population in Hong Kong. We want to make sure there's a proper elderly care sector. So it's therefore essential that you consider the staff aspect. Now Dr. Ko Wing-man is here. Thank you. Last year, I and some stakeholders with some sort of issues, and the doctors and the carers, we came to meet you. They have problems with some sort of recognition deficiency. And thank you for setting up a special task force to look into this disorder. But this year, we want more than just a task force. We want something concrete to be done. So there will be proper cooperation between the medical sector and the other stakeholders. Now, the two secretaries, I know you have good working coordination. But it's not the case at the hospital level. Now, there's one patient, an elderly patient. He's waited more than a year before he could get treatment, and then he's diagnosed to have mid-stage Alzheimer's disease, and then he was referred to social welfare, to a social worker, but then he couldn't pass the standard assessment because he's still able to move around, although he may be lost as he goes home, but he's still able to function. So when we talk about collaboration between the medical sector and the social worker sector, it's about if someone is diagnosed, then perhaps medically or non-medically there should be proper services to help these people, the Alzheimer's disease patients. Now, in this case, this patient's waited a long time to see a doctor, but still he gets no service. Now, the name, dementia, in Chinese they're using a different name, but I think there should be more collaboration. Don't say that last year we gave $200 million to the social welfare sector to give support. This year we just give $300 million. That's good enough. No, it's not about this. It's about the system itself. And there's a report that says that dementia is a challenge facing the entire world. Medical costs and non-medical costs will take up 1% of the global GDP, so it's not an issue to be shoved under the carpet. Now, the Department of Health or even the Secretary said that for those aged 70 above, 1 in 10 has dementia. So we have to face up to the problem given this ratio. Aging with support, that's something we all care about. So we don't see how you could still allow the offsetting mechanism under the MPF, because at the end, people get nothing more. Now, it's 5% of the wage is just to be put through the fund manager, but at the end, the employer's contribution doesn't go to me. Or yes, it goes to me, but that means I will collect less in MPF payment. Now, this is just one pillar to force employees to save. That's why we are very much against the offsetting mechanism. Yes, you're trying very hard to lower the administrative costs, but already in 2013, fund managers have collected $8.7 billion of the hard-earned money of employees in terms of the fees. Now you're going to have a fund. Perhaps you could take $200 billion out of the Learned Reserve Fund. This fund will be used for preparing for a universal retirement protection. Can you do that? Thank you. Dr. Helena Wong. I'll first speak on women and child care, and then I'll talk about food and health. On women, there's so little mentioned here. Just paragraphs 88 and 89 where there's some brief mention of women. Half of our population is women, but it seems that there are not any measures to help them or take care of them at all. Child care is mentioned here. We understand the government is now dealing with the population policy. In terms of the child care service currently in Hong Kong, we all know there's a serious shortfall. In the policy address, is only proposing minor fixes. But this is overlooked the strong demand for child care services by the large number of women in Hong Kong. The Democratic Party finds that most disappointing. For children aged between 0 and 2, there are at 0 and 6, there are 340,000. Child care service places, less than 30,000. Now, you encourage people to give birth. Okay, so they have children. What do? Are they to take care of the children themselves? And this child care service now can only serve 10% of the children population. And there's a service very popular with parents. We've said this many times. That is the subsidized full day child care centers. How come all these years you are still keeping just 690 places? You wouldn't add an additional place? So are you sincere about listening to the demands of women? For these child care centers in the 80 districts of Hong Kong, for many years, these centers have reached saturation, 100% usage rate. The centers are absolutely full. The waiting time could be a year or even 2. Still, you won't get a place. The secretary may say, well, if this center is full, go to another center. Now we're talking about the full-day subsidized places. How come the government wouldn't increase such places? Now the government sees needs in this sector. How come you wouldn't put the people first? Yes, it's true in the policy address there's some brief mention of something that might offer a little bit of help. After school care service, you are lowering the age restriction, and the neighborhood care program. You're also, again, expanding the coverage from 6 years to 9 years. And, of course, some may say, what about those above 9 years of age? And then for care services, you're going to give more resources. You're going to extend the service hours. This is a response to the demands of some women saying that they finish work late. They can't pick up their children too early. Yes, that's good. But we don't see an increase in places. So I hope the government will take a good look at the child care services in the different districts and see if you could increase the number of places and bring about improvement to such services. As for the neighborhood nannies, are you trying to take advantage of them? Well, you're saying that, well, these neighborhood nannies are already taking care of the children, so they could look after a few more children. So it's more or less like voluntary service. You just pay them about $20 an hour. I don't think it's fair. I don't think it's humane. Taking care of children is a job. It's not voluntary service out of compassion, because it takes time to take care of children. They take care of their own children. They take care of other people's children. It's not the same as just taking care of their own children in terms of the stress and the workload involved. So, Secretary, I hope you will do a proper review. You should revise the hourly rate to at least $30, equivalent to the statutory minimum wage. Otherwise, you can't really, you are not being fair to women. Now, if the government is sincere about taking care of the needs of women, then we need to provide more and better quality, affordable and diversified childcare services. Why? It's not just about the government responding to the shortage of manpower in the labor market. So we want to release the potential women to join the workforce. Now, of course, if women have to stay home to take care of the children or others, they may decide whether they want to join the workforce again based on their own circumstances. But we cannot regard women as the reserve of the workforce. That is, when there's a shortage of manpower, then the government will see, okay, what we can do to let women go back into the job market. But what if the job market is doing fine? Will you change your policy so you chase women back home? I think you have to think this through very carefully. In providing childcare services, in improving your family-friendly employment policies, you have to show respect to women. You have to give them the choice. Is that right? So expanding childcare services is just not about allowing women to work. But in an equal opportunities community, there should be equalities between the gender. That means women should have the free choice to decide how much time they want to spend at home and how much time they want to spend going to work. It should be a free choice for them. If there is no childcare service, of course they don't even get a choice. For the middle class, maybe they could choose to hire a foreign domestic helper. But for the grassroots sector, they have no choice then. So we are striving for childcare services because we want women to have genuine choice. But of course, the result could be that more women could then join the workforce. On the women's issue, we hope the government will press ahead with the promotion of the family-friendly employment policies, and you should review the paid maternity leave arrangement. Now, only 4/5 pay is required, but could you be more generous? Make it full pay maternity leave, 10 weeks of full pay maternity leave, and could you extend it a bit so women have more time to rest after the childbirth? Paternity leave, the Democratic Party hopes you will proceed with legislation very soon. But 3 days only to fathers? That's a shame. You know, how much can they do to help the family? Is there room to extend it to 1 week or 2 weeks? So fathers could also shoulder their responsibility, or husbands to shoulder their responsibility after their wives have given birth. Now, Dr. Ko is here, so I'd like to talk about food safety, columbariums, and animal welfare and rights.
最新嘅消息
Bureau Director, the latest news is, as we all know, before the Lunar New Year, as H7N9 was discovered in some chickens imported from mainland. You banned all chickens from the Changsha-wan wholesale market, and all chickens had to be killed, 20,000 odd of them, and the market was to suspend business for 21 days. Now that suspension order is to expire next Tuesday. In fact, different people, including those from the Democratic Party and myself, suggested that after the spate of incidents and the spreading of H7N9 to many mainland cities with gradually increasing fatality cases, the government should temporarily stop importing mainland chickens in order to reduce the risk related to H7N9. The government turned a deaf ear to our proposals, and now people died. And then eventually you had to ban live chickens from the mainland. Problems were discovered with these live chickens. And all along, the administration has not noted, or probably you knew it, but you would like to bet on that. In the whole of Hong Kong, there's only one wholesale market, that is to house both mainland live chickens and local live chickens. And before the serum test results are known, the chickens are mixed together. Eventually, all chickens had to be slaughtered. The chickens died rather unnecessarily. Local chicken farmers suffered unnecessarily, and also their mainland counterparts. In fact, in the Food and Environmental Hygiene Panel of the LegCo, we raised a number of times this issue, but you said that's not necessary. Chicken farms on the mainland that supply chickens to Hong Kong are separated from those supplying to the mainland. But when they come to Hong Kong, the chickens are mixed with the local chickens. All right, this big incident occurred. We now have this compensation issue. I don't know who is to pay the compensation. Bureau Director, the suspension order is to expire next Tuesday. Before that order expires, can you identify a separate site to handle mainland chickens? You say there are suitable land sites, but there are all sorts of problems. Water supply, sewage disposal, electricity supply, whether or not there are chicken farms nearby, etc., etc. All right, before next Tuesday, can you find a place to handle mainland chickens? Mr. President, I'd like the government to seriously consider one matter. Bureau Director, rather than identifying another site to handle mainland chickens, should you consider immediately banning the importation of mainland live chickens into Hong Kong permanently? Because on the mainland, there is this continued outbreak of H7N9. The most serious provinces are Zhejiang and Guangdong. In Zhejiang, they've already announced the closure of live poultry markets in major cities. You see, even the mainland authorities are concerned about this. Guangdong hasn't closed those markets yet. That means Guangdong will have the highest chance of supplying those chickens to Hong Kong. Bureau Director, rather than letting all Hong Kong people be exposed to that risk, before next week, can you immediately decide to ban the importation of live chickens from the mainland immediately? In fact, 2/3 of the live chickens supplied in Hong Kong are raised locally. Well, local authorities and farms can handle these 7,000 live chickens, extra 7,000. So the situation will be improved to a certain extent. Of course, in the long run, the whole of Hong Kong has to consider whether or not we should give up live chickens altogether. Before next Tuesday, if you cannot identify another site to handle mainland live chickens, if you still put those chickens in Changsha Wan wholesale market, you are engaging in another gamble. You cannot rule out the possibility of another incident which warrants the slaughtering of all live chickens. Let me come to columbarium services. That's not mentioned at all in the policy address. I worked very hard in turning the leaves of this policy agenda. I found 2 sentences, but still they are very hollow in content. Columbarium is just like the housing problem. It seems that the government is hands-tied, but at least for the housing problem, An LTHS steering committee was set up to work out objectives, time frame, etc., etc. But for accommodation for the deceased, the government has not proposed any solution. At the moment, the supply of columbarium facilities is in shortage. This has been a long-standing problem. Supply has never caught up with demand in the public sector. Therefore, people are forced to fetch private niches. Some of them are lawful, some are illegal. We don't see any determination and policies from the government to face that difficulties. In November, in the panel, the government said that 24 sites would be identified for this purpose. In fact, those sites were identified in the last term of the SARG, but not all 24 sites are feasible immediately. You are to beg each and every district council. I don't know what conversation had gone between you and Dr. Ko. Are you willing to go to the district councils? It won't be surprising to see opposition from the district councils. The bureau director will say, my hands are tied. We have limited land sites. Should we use them for housing units or columbarium facilities? In the next 10 years or 20 years, we cannot see the possibility of an adequate supply of niches. Of course, we can encourage green burial, sea burial, etc. But all these cannot solve the problem totally. All right, Bureau Director, where opposition is not so strong, can you try your very best to do something? I'd like to say something about rock caverns. In 2010, the Development Bureau also suggested that rock caverns be used. A feasibility study was carried out by a consultancy firm. It's discovered that columbarium facilities can be provided in rock caverns. But then we saw no follow-up action on the part of the government. Is that a way out to resolve the shortage of columbarium facilities? Apart from public columbarium facilities, on which we see a dim future because we don't see any outlet from the government, supply in the public sector will never be able to catch up with demand. But what about private columbarium services or facilities? The government has said a number of times that it would legislate to regulate private columbarium facilities and services. I'd like the government to quicken its pace, because if you do not increase public supply, people will be forced to patronize the private sector. However, in the private sector, many columbarium facilities are illegal. We received a lot of complaints in that regard. Residents complained that by their side, people are occupying government lots to provide columbarium facilities and services. The aggrieved came to complain to us, but they were tortured by various government departments. They're being passed from one department to another. Well, not even the Food and Health Bureau or the FEHD will be able to solve the problem, I think. I hope that the CS can lead an interdepartmental working group to handle this columbarium issue. Otherwise, in the FEHD, in the Lands Department, in the Town Planning Board, in the courts, etc., etc., this issue will be going round and round, accumulating a great deal of dissentment. Here in this chamber, many members have asked the administration to introduce animal policemen. And then we should review our animal welfare laws to see whether or not they're outdated. But up to this moment, we've not seen any concrete measures on the part of the government. The FEH panel and other colleagues visited the doghouse in Shangshui. That's government facility. But the AFCD said that reporters should not be allowed in. Media should be banned. They put up a lot of excuses. For example, they said cases had to go to court. We also visited Mankamto to see how mainland food products entered Hong Kong, how bird flu serum tests are conducted, how surveillance tests are conducted. We also invited the media to visit the facilities, but then they were also banned. The officials said that the venues were small, etc., etc. Well, councillors are to monitor the government. The media also have to play that role. So why should government departments be hiding things? Are you afraid of exposing anything? I hope that government departments will I hope that government departments will not hide how they're governing Hong Kong. I hope government departments will not ban the media in reporting. I hope that the CS will look into the departments to see what had gone wrong. Are there any guidelines to ban reporters to accompany councillors in study tours? We're also very concerned about the sale and purchase of pets. It's said that a law is forthcoming, but we don't know when it will come. And recently, we discussed the neutering system for the stray dogs. But we understand that the government departments lack support. All along they're saying that they have to conduct experiments, but they couldn't find suitable premises. In the private sector, many people are already privately assisting the government to do that. So please send officials to visit these NGOs to see what they're doing and see whether there can be any collaborative projects. And President, we are of course most concerned about food safety. We hope that the Bureau Director can do gatekeeping well. Many of our food products are imported. We'll continue to visit various units and departments. I hope that the Bureau Director will take the lead in doing gatekeeping. Mr. Albert Ho, Mr. Deputy, the poorest part of the policy address is the part on governance. Our future is dim. The public has lost confidence in the governing team. I must admit that on poverty alleviation and welfare, relatively speaking, when compared with past policy addresses, this policy address is more enterprising. Particularly for the low-income working family subsidy, I have to emphasize that for many years, amongst all the measures to assist the poor, this is one of the most important and one of the most enterprising measures.
We'd like to work hard on it so that it becomes a reality. In the PA, some details have been given. Certainly, there is still a distance between the aspirations from certain organizations and what is proposed. For example, some people say there should not be any income assessment. They say it's not worth your while. You may spend a lot of resources on vetting and you do not achieve a lot. But then, it is said that you can make use of other conditions. However, what is most controversial is the number of hours worked. I think many members have spoken on it, 208. 208 is really too high a figure. It is higher than the standard working hours championed by labor organizations, and is also higher than the maximum or standard working hours in advanced countries. Why do you put such a high threshold before people can get the $1,000? Why so harsh? That's the first point. Secondly, has the administration thought about this? People find it difficult to get a job. It is not that I will try to find a job and I will work hard at it. Even if you want to, you cannot get a job. As you know, many grassroots work, piece-rated work. Sometimes in a month they may have many hours, but in another month it may not be as easy for them to find the same kind of work. Plus, some families have their special characteristics. Say it's a single-parent family, or there are chronically ill family members, or family members with learning difficulties. I think you have to give consideration to all those. Your broad brush approach, which does not give consideration to these special factors, is not good enough. It is just that if you do not reach that kind of working hours, you will have a few $100s less. This is not fair. Some people say a few $100s is not a lot, but you are talking about helping the poor, and every cent is important. Don't give people the impression that because you do not work hard enough, therefore you do not get a high subsidy. And also, on institutions, we still face the same problem, and that is you have exerted more efforts on the homes for the elderly. There will be an increase of 500 beds in nursing homes, and also you will increase the voucher value. However, look at the queue. People are waiting 37 months now for a place. In 2011, there are 5,000 people who die without getting a place. But that figure is not a frozen figure. We are aging as a population. If you do not factor this in and let us know what kind of target of improvement you want to achieve, I think this is not enough. It is the same for institutions for the disabled. You are not tackling 1/3 of the demand. In other words, the number of places you propose to provide cannot even take care of 1/3 of the demand. And what is more serious is that for the medium mentally handicapped and the seriously mentally handicapped, the median waiting time is 80 months. How can that be? As for the elderly community care voucher, as members have said, there are inadequacies in the scheme. But you have to work together with institutions. I understand you need to have experimental schemes, but it seems you have to work for many years before you can provide the few thousand vouchers. How are you going to complement or work alongside institutions which are providing services? I think you have to look into it. But in any case, the progress is very slow, but then demand is keen. All in all, the FS is getting very worried because a lot of money is going to be spent, and he says our reserves will be depleted. But we are talking about $7 billion, and the Democratic camp can see that the average reserve annually, and if you also look at the cumulative reserve and surplus in our coffers, the increase of $7 billion recurrent expenditure is not a lot. I have said that we should increase it to $20 billion, not necessarily only on welfare, but maybe education and medical services, which should also be improved. Welfare planning is also important. We hope there will be a white paper. You need to train up manpower in order to roll in improvements. You have to have land planning. You have to look at the mode of delivery of services. And what is more important is you have to assess the demand for long-term services. This has something to do with the aging of the population, so we need a white paper to lay down indicators of service provision. If you just look at 2-3 years down the road, that is not enough. I think you owe the society a white paper on service delivery. So we know the mode of development of mode of services and also manpower training, etc., etc. Now let me turn to medical service delivery. I will just make 2 points. One, reform of the hospital authority. I think that is so important. You can see now that we always criticize the problems affecting the clusters, that people have this turf war, and there is stringent resources. And recently, some key performance indicators for hospitals have been announced by the hospital authority, and it seems some hospitals are doing very badly. And you get very afraid after looking at that kind of figure, because there is a high risk of death after surgeries, and people are worried about our hospital services. I can tell the Bureau Secretary that some doctors are very unhappy about this because they say it's unfair to them. And these hospitals do not have the right manpower level. No, they don't even have enough senior doctors. Their doctors do not mind the heavy workload. They like to work on the front line and in a very bad working environment. And then it is said that your performance is relatively not so good. But that is understandable because you do not have an adequate working environment. And yet you tell people that the doctors are not doing good enough. And yet you do not have a mechanism to study into the situation. And that is why some hospitals are not performing that well. And you do not have measures to help them improve the service. That is a big problem. There are hospitals in remote areas where there is a lack of doctors and also particularly a lack of consultant doctors. If there are difficult surgeries to perform, we are rightly worried that the doctors are not experienced enough for them. So how can hospitals support one another? Can we deploy manpower in such a way that they can rotate from hospital to hospital? In other words, consultant doctors who are experienced, can they be deployed to remote places to support the delivery of medical services there? If there is still this cluster system, if you do not reform it, I'm sure you cannot do a lot. So, Bureau Secretary, in the days to come, we would expect you to reform the hospital authority. We hope there will be a proposal for doing that for discussion with us. And then I like to talk about primary health care. This is important, especially when the population is aging. We don't want to take everything to hospitals. But then, primary health care, is it delivered well or not? You know it in your heart. You cannot just do publicity and education. You need district health centers to help the chronically ill. You help the elderly by providing physical examination. And if there are minor ailments, you should be able to cure them at the district level. Say, for example, if they suffer from dementia, then you can support elderly people by providing primary health care. You know, our ward officers can provide blood tests or urine tests for people, and people are queuing up for such services. We need more resources, and NGOs can complement your work in providing primary care for doing education, publicity, and also physical examination. I hope you understand the urgency of this task, and I'm sure the community will support you in providing better primary health care. Mr. Yiu-chung. Mr. Deputy, last year, the new term government already rolled out new measures for welfare services, including restarting the Commission on Poverty and elderly transport subsidy and also WITSS, etc. There are these breakthroughs for welfare services, and again, the PA this time suggests new policies, including the LIFA, Low Income Working Family Subsidy, and also a special scheme to provide welfare services on private land, and also increasing the healthcare voucher scheme for elderly people and regularizing 7 CCF programs. So the PA has mapped out the directions for providing care for the elderly and poverty alleviation. I think these efforts are very targeted. I believe we should support the PA just because of the welfare commitments. Poverty alleviation is the most important policy for this government. And if you look at the causes of poverty, if you look at it from the perspective of an individual, it may be attributable to low income, changes in the family, or aging. Therefore, effective alleviation measures must include a whole package of employment assistance and financial assistance. And there must be proactive financial measures to complement it. The last term government did not do anything for long-term welfare service spending because it is said that there would be long-term financial commitment. Yes, it went for the dishing out of goodies or short-term measures, but then they were not able to resolve the actual difficulties. And the DAB has always said that outside the CSSA, we should have a second-tier safety net. So people who are not on CSSA but working in the labor market, and if the families have a low income, then after income and asset tests, they should be given some kind of subsidy every month. And this has been implemented or proposed to be implemented in the PA. There will be the LIFA, costing about $3 billion every year. Over 200,000 low-income families involving 710,000 people will benefit, so we support the scheme. The LIFA will cause an increase in government recurrent expenditure. But the aging of the population will also have to be looked at. And indeed, that kind of recurrent expenditure will, in a way, remain stable. So I believe the government is in a position to continue with that kind of spending. The DAB agrees that there should be income test, or else taxpayers will think that they are supporting people with high incomes, and there will be the creation of class conflicts. The design of the LIFA is such that apart from the basic subsidy, basing on the family situation of the applicants, there will be the child allowance to be paid. In other words, there will be prevention of intergenerational poverty. And it is said that the childhood or children poverty rate will go down by 4.4% as a result. But then we think the threshold can be lowered in 2 aspects so that the system will help low-income families more effectively. 1, to lower the application criteria for families with chronically ill members and disabled members. And as other members have said, this has to do with the adjustment to working hours. If there are disabled people in a family or chronically ill members in the family and they have a low income, now as you know, the two are very much related. The administration does have the disability allowance, and also you will introduce a pilot scheme for elderly health care for low-income families. However, you are actually helping different target groups.
For example, carers for the elderly, they may not be members of the family. That's why in the LIFA system, low-income working family allowance system, there should be an additional allowance for family with members with disabilities or chronic illness. Then they could get the help they need. Now, the working hours must be no less than 208 per month. I think it's a bit too stringent. That means people have to work 52 hours per week on average. Now, Secretary, you said recently in an open forum, you quoted from statistics of the Census and Statistics Department. Now, for those working 208 hours a week, a month, they only account for 30% of the working population in Hong Kong. That means for the majority of low-income families who need help because they could not meet the 208 working hour requirement, they cannot collect the full allowance. Now, casual workers are common. Most grassroots people work as casual workers in restaurants, construction sites, and so on. If the condition is too rigid, we cannot encourage such people to join the workforce and improve their standard livelihood. Maybe you could count the collective working hours of the entire family. Then you could give concrete assistance to such families. There's another breakthrough in welfare policy and service, that is the special scheme for welfare institutions on private land. Now, there's far-reaching impact, but somehow it's not picked up much. The DAB has always asked the government to set up a 5-year social welfare plan. You should set service targets, and you should set aside enough resources. But the government has always turned down our requests. One reason given is that there is now the standing current budget arrangement for each department. There's a cap on expenditure each year, and the departments will have to spend within the cap. So based on the budget every year. So it's not possible to set aside expenditure for a department for 5 years. So the department is not able to make long-term planning as a result. Last year, in the first policy address of the chief executive, he said that the government would adopt a pragmatic and flexible approach through various channels. The government will look for land sites to provide the necessary service. At the time, I said if the government just wanted to resolve matters in this manner, their effort would be reduced in terms of effect. We believe, the DAB believes that there should be long-term targets and strategy, and there should be a 5-year plan for community care services and elderly services, and there should be a waiting target too for those waiting for home places or community services. And then on the basis of such targets, you can then decide how much manpower you need. Now, there's need to provide the necessary financial backing for such initiatives. That's why the DAB proposes a service fund. So you could reserve resources for the medium and long-term planning of various types of homes and care services. In terms of hardware, the government is responding proactively to public demands. The government is to inject $10 billion in the lotteries fund. The lotteries fund itself has already $10 billion in reserve, so there will be $20 billion in funds, and encourage existing institutions to either expand or redevelop. Now, if all the initiatives are put in place, there will be an additional 17,000 care places for the elderly in total. So it's like the government is setting up a dedicated fund. Is to make sure that institutions have enough financial resources, and then the social work department doesn't have to compete for funds under the operating expenditure envelope mechanism. That means the department could roll out new places sooner. But still, they have to address two issues. One, the coordination of expansion or redevelopment of institutions. Now, very often, for redevelopment, there is need to seek town planning approval. There may also be a need to modify the lease and seek approval from the lands department. For such a planning and lands procedures, it could take from 1 or 2 years to 3 or 4 years even. And with building as well, that means the new homes could only come into place after 5-6 years, or if there's any delay, it will be 8-10 years. That's why the new places could not always be provided in time, because the process is so cumbersome. For example, in 2012 to 13, in that financial year, the Social Welfare Department planned to increase the number of care and attention places, but 165 board places could not be provided because they could only increase the number of places by 180. It's less than half of the target. They couldn't even meet half of the target. So that's why the government must strengthen its coordination work. It must support the plans of homes, and there should be a clear time frame, so you will make sure that the places are in place on schedule. And about identifying suitable sites or increasing places in central and western, Wan Chai, Sam Shui Po, where there's bigger aging population, there are few new places available. In some places there are no new places at all. And for persons with disabilities, again, the government's not able to provide home places in these districts. So the government has to plan the construction of such homes in an orderly manner. It will make sure that elderly persons and persons with disabilities have a wider choice, and they're able to stay in the district that they are familiar with. On recreation policy of the government, there's generally a framework, and I think all sectors accept it. So what's left to be done is to make sure you do deliver. And on expanding the community care fund and the scope of subsidy scheme on dental services for the elderly, you should expand such programs, because few elderly are able to benefit. I think there are just 23,000 who could apply for home care services, but the need is some 100,000, so there's a far cry from meeting the needs. And the voucher, you're going to increase the amount by $1,000, but still that will not address all the problems. So I hope the government will consider it again. And I've said on many occasions that the government should consider how you disperse the allowance if necessary. You should allow people to buy the service they need in the market, because there are few dentists joining the scheme at the moment. So elderly people are still suffering from dental problems. We hope the government will actively improve various welfare services and provide a comprehensive social welfare network system. Thank you. Mr. Ray Chan. Thank you, Mr. Chairman. Since C.Y. Leung took office, he didn't do much good. Sometimes we thought he might have done something good, but actually it will end up being a farce or even a tragedy. He proposed the old age living allowance when he assumed office. We asked for non-means test. In fact, other political parties also asked the government to relax the asset limit, but the C.Y. Leung would not yield an inch. Now is the low-income working families allowance. Again, it's supposed to be something good, but again, there's much criticism from various sectors. Now, I propose that you should do away with asset limit for people who are eligible for LEFA. It's because they don't want to get CSSA. They want to rely on themselves. They want to find work. If they're lazy, they could just forget about working. They could stay home, and they are eligible for CSSA. But no, they don't choose that route. They choose to work. But of course, there are some families with various reasons, because of the relationship among family members. If you ask them to declare asset, there would be some difficulty. So at the end, although they are struggling, they cannot apply for CSSA. And of course, what attracts criticism is the two-tier system. For working family members, they have to work 144 hours per month, so they get allowance of $600. But if they want to collect the full allowance, then they must work 208 hours per month, and they could get $1,000. That means every week they have to work 48 hours or more. This is a very harsh requirement. But then Matthew Chung would put it the other way. He would say that the requirement is relaxed and liberal. It's because for the basic allowance is 144 hours, so every week they need only work about 34 hours and they could get $600. For the $1,000, it's just to give you additional reward of $400. Is to reward you for working hard. So that's why you get a $400 more. I'm sure you will recall what he said at the panel. If members think it's not a good thing, then we can just forget about the reward for hard work, and we will standardize the payment at $600. Now, I don't know whether I should laugh or cry. Or what about standardizing the working hours at 144 and the amount at $1,000? How do you do your calculation? Now, the item is going to cost $3 billion. We found the money for you. You just need to charge people $100 for arrival tax, and you'll be able to get this money. So you don't need to be so stingy. Now, whether it's about helping the poor or whether it's an incentive, whatever you look at it, the government is always afraid that the people will cheat them of the money, that you overpay people, they can't spend it. That's why you're always so calculating when it comes to such schemes. Now, 208 hours per month, 48 hours per week, it doesn't add up. Because for these working poor families, it's because they have children, they have elderly people, they have patients to take care of. That's why they cannot work so many hours. And that's why they cannot make so much money. That's why they couldn't make ends meet. Now you say you want to give them an allowance to help them out a bit. Some want to do more work, but they can't find the work. Now, if they want to meet the working hours requirement, do they have to work on weekends? They work several hours during the weekends, say at convenience stores, so they could make up the 48 hours per week. Now, we're talking about standard working hours, maximum working hours of 40 hours, 44 hours per week. It's considered very fair. Now, this gives the impression, but perhaps Matthew Chung would put it the other way. You might say, no, that's not what you mean, that that's a reward for people working hard, but actually it's a reward for people putting up to meanness. Because it's not humane to ask people to work 48 hours a week. But then you're giving the impression that you draw the line at 48 hours a week and then you can get a full allowance. If the government is to come up with a policy to encourage childbirth, this 48 hours is at odds with that initiative. Why don't people give birth to children? Because they don't have time. When they finish work, they're too tired to do anything. My friends have to take a holiday to do something so they could have children. But after they have children, maybe they have no time to take care of their children. So this is about population policy, it's about labor policy. For this liver, we can see it's the same issue. For the two-tier system, there are plenty of gaps and loopholes. For people at the fringe, if they want to collect the full allowance, they have to pick a job that pays a bit less, or they have to ask employers to reduce their wage, or they have to give false declaration of working hours. Now that, again, is a departure from the original intention of the policy. Paragraph 65, the subsidy scheme for carers. This is a good scheme.
But the experiment time is too long and the scale is too small. Only $120 million for 2,000 eligible elders would be placed under the experiment, which will last for 2 years. So nothing new will come forth in those 2 years. So 2,000 places for you to experiment. Can you shorten the experiment period to, say, 1 year? This is my suggestion for this policy. Finally, I'd like to take this opportunity to point out that many welfare policies and poverty alleviation measures are family-based. It's just like the LIFA. It is not taking care of the individuals. Of course, you say that the policy is to encourage people to form families. If you do not form families, you're not entitled to the allowance. Sorry, there are some people in Hong Kong who don't even have the right to form families. For example, those with different sex orientations. It's just like W. The government doesn't want to give him the right to form families. It's just because he won the CFA case that he was given that right. So there are people who don't know when they'll get the right to form families. There are not only homosexuals. There are also the singletons. There's no chance for them to apply for this LIFA, even though their income is low. So, family-based welfare policies, please take care of the singletons, particularly those people who don't have the right to form families. And Bureau Director, I'd like to take this opportunity to make a suggestion. Please allocate some resources to the homosexuals in terms of social welfare. There are dedicated services for young homosexuals and their parents. They're now relying on private funds. They have to do fundraising in order to get a social worker. So they'd like to have some resources from the SWD so that they have dedicated services for the homosexuals. Of course, you say that integrated family centers will suffice. If in your family you have a gay, your family is to collapse, just go to the integrated family centers to seek counseling services. Bear in mind that if we have dedicated social workers professionally trained for that purpose, it would be better. This policy address has a number of measures for the ethnic minorities, which amount to 5% of our population. For homosexuals, we don't have local data, but internationally, 5 to 10%. They do need welfare services, poverty alleviation measures, etc. Even if you are not going to legislate, where and when possible, do allocate them some resources to help them. Bureau Director, I hope you hear me. And Dr. Ko, some of them got funding from the AIDS Fund. And the female homosexuals complained because they say sex behavior is safe. But they're unable to obtain funding from the AIDS Fund or AIDS Foundation. So, healthcare is healthcare, medical is medical, social welfare is social welfare, AIDS is AIDS. So please, when you implement welfare services, please consider all aspects, particularly the needs of the sexual minorities. Mr. Chung Kwok-chi.